Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the COVID-19 weekly pandemic update with data accurate through March 10th, 2022. This week, I'm going to address two questions. First is, how can I get my mind around 6 million deaths? And the second question that came in from a viewer, what should I know about wastewater testing? Well, how can I get my mind around 6 million deaths? Obviously, what I mean here is that earlier this week, the global number of deaths is estimated to have surpassed 6 million. And sometimes with a number that large, it's hard to get your head around it. So let's look at it this way. 6 million is more than any city population in the United States except New York City. And in fact, it's 9 times higher than the population of Nashville, Tennessee. You can imagine the impact of losing 9 Nashvilles on human life. It's more than the population of 30 of our states, each independently, all the states from Wisconsin down, Wisconsin, Colorado, South Carolina, all the way down to the bottom, all have less than 6 million people. In fact, 6 million people is more than the population of about half of the world's countries. And I can't show them all. If you look at the worst pandemics in recorded history in terms of total deaths, 6 million places COVID somewhere in that range. And the reason there's a range there is because those earlier pandemics, the ones at 8, 9, and 10, have a wide range between 5 and 8, 5 and 10, 5 and 15 million. So COVID is somewhere between number 11 and number 8 of the worst pandemics of all time in terms of total deaths. But perhaps the best way to think about it is in terms of total deaths. Every year, the world has about 58 million deaths, at least it did before COVID. So 6 million is about 1/10 of the deaths that we would expect in 1 year. And because those deaths occurred over 2 years, it represents about a 5% increase in the number of deaths for each of the last 2 years. And those are all great statistics, but at the end of the day, this is 6 million grandfathers, grandmothers, fathers, mothers, uncles, aunts, and so on, musicians, factory workers, mechanics, waiters, politicians. 6 million human lives everywhere in the world. And unfortunately, the pandemic is not over. If you look at global cases, we were watching the Omicron variant reduction. It appears possibly to be leveling off. That would be quite serious and unexpected. In terms of total deaths, daily deaths, you can see it has been coming down. It's now about where it was at its typical baseline between the very beginning and now. So not below, certainly not anywhere close to zero. In fact, we're seeing still about 6,700 deaths every day. And of course, we have passed 6 million total deaths. We're seeing a little bit more optimistic pattern in the US with the number of cases well down below where it typically was. In terms of deaths, we're still above the lower baseline, if you will. We're seeing about 1,000 deaths a day. So this is not over. And we're 990,000 deaths to date. And I suspect in a week or 2 or 3, we'll be talking about reaching 1 million deaths in the United States. In terms of where these cases are, we've been following this over the past couple of months. We saw an explosion of cases as Omicron spread everywhere. And then it quickly decreased with now about 3, what I would call hotspots. Northern Maine, for whatever reason, Northwest area, and then here in Central Appalachia. In terms of Tennessee, we're seeing a reduction in cases and a reduction in deaths. But we still had almost 25,000 deaths in our state, and we had about 180 deaths last week. In terms of our local region, we're still above our lower limit, but we're glad to see the number of hospitalizations coming down. But if someone had told you or me that we'd have 177 cases in a hospital of one particular outbreak, we'd all be going, my gosh, that's horrible. And it is. So how do I get my mind around 6 million deaths? You really can't. You have to say this is, we have to understand it one death, one person at a time. Every single one of those deaths represents a loss to a family, to a neighborhood, to a community, to a country, and to us as a human race. Question came in, what should I know about wastewater testing? Well, what we do know is that the virus that causes COVID is shed in the feces, as we like to say in public health, between 40 and 80% of people, even if they don't have symptoms. So if you've got the virus in your body, there will probably be some viral particles in the stool that can be detected in wastewater. And that allows wastewater surveillance to be an early warning, an early indication. According to the CDC, wastewater surveillance captures the presence of SARS-CoV-2 by measuring the level of it in untreated water over time. You can determine if infections are increasing or decreasing, and it's a very straightforward thing. You collect information from the sewer shed, as I guess as they say. It can be an early indicator that the number of people with COVID in a community is increasing or decreasing. Houston has a very good website. If you're interested, you can see down arrows in those collection systems that are going down, up arrows where it's going up, and you can follow it over time. Unlike other types of surveillance, wastewater surveillance does not depend on people going to the doctor. This is particularly important now that there are home test kits, because it's very possible that people won't report their positive test results. And so this gives, wastewater testing gives some measure of what's going on. And it can be implemented anywhere there is a sewer system, if you will. And that's about 80% of the households in America. But this map shows places with inadequate or incomplete plumbing, and you can see a concentration here in Central Appalachia. So wastewater testing is okay. It's not a replacement for individuals getting tested. And I think the way to think of it is when the numbers are pretty low, as they have been lately, it's a good indicator that something is increasing or decreasing. It's not a replacement for individuals getting access to healthcare, and it's certainly not a reason not to engage in those activities that protect us, such as getting vaccinated. So how do I get my mind around 6 million deaths? Think of it as 6 million individuals, 6 million families, 6 million communities, and so on. And what should I know about wastewater testing? It's a reasonable approach, especially when the number of cases is low. A great deal more information about COVID-19 on the College of Public Health website. If you know anyone who'd like to be added to our mailing list, please let us know. Thanks as always to Dara Young for editing, producing, and posting this video. And as always, I look forward to your questions. Please let me know if you have any questions or comments on what I've said this week or about the pandemic more generally. I look forward to hearing from you. Until next week, please be well.